Welcome back to Yahoo Finance Live. Our Angelique Emlani spoke with Northwell Health CEO Michael Dowling at JP Morgan's healthcare conference. They discussed the federal government's response to COVID-19, his outlook for the Biden administration, and the rise of telehealth.
Speaking of government, I know that the government has taken, at least at the federal level, a lot of criticism for the way that the pandemic has been handled. I wonder, how has that, or how did that affect your ability to respond? And do you see a potential change with the incoming administration? What are you looking for there?
Well, and part of the first part of your question is that we had been preparing for situations like this for many years. We're pretty organized as a health system. We're very, very integrated. We all work together despite the scale and size of what we are. And we put together a major emergency manager disaster preparedness infrastructure years ago. That became unbelievably helpful during COVID. So we were better prepared than most. Nationally, we were terribly unprepared. We should have been doing things over the past quite a number of years to prepare for this. And the evidence was there, the facts were there, everybody knew about it. We've discussed it in the past. And also we saw colossal failure of leadership with the recent, with the current administration in Washington. And, you know, I often think that what would the world be like today if back in April, the president had stood up and says that we have to have a unified effort around this. Everybody should wear a mask. We should have some consistent rules and guidance. I guess that we would be in a much better position today. So now with a new administration coming in, I believe that there will be a much more openness to accept the reality that we're in the middle of a pandemic. We've got to learn what we didn't do right this time and then begin to plan for the inevitability of something like this happening again. So I think we'll be in a better situation, but it will require a consistency of effort. You know, people have a tendency when you're in a crisis, everybody gets all excited, and then the crisis disbands, and all of a sudden people go back to the old ways and you forget. We cannot let people forget now, because you will have another virus, you will have another COVID-type situation in the future. This is the inevitable part of modern life, and we have to be better prepared. The new administration, I think, that is more of an openness. They accept reality, and they're more progressive in how they approach it, and therefore I'm a little bit more confident, quite more confident, in fact, about what we'll be able to do together going forward. It has been a bit of a nightmare over the past 9 months and dealing with the federal government, to be quite candid about it.
Well, hopefully we'll be watching a shift together. When we talk about, you know, one of the major changes as well to how you've had to operate, and I think going forward, this is another theme, has been the telehealth and, you know, just in general technology, digital services, remote monitoring, the whole umbrella seems to have gotten a really significant boost. But of the things that we saw really gain traction, what do you think is going to actually stick around? And what parts are you ramping up and implementing or scaling up?
Oh, I think so much is going to change. I mean, the relationship with technology, our relationship with technology overall has completely changed. So, for example, since April, we have been managing Northwell virtually. And the management team is not together much. We work remotely. We use Zoom and Microsoft Teams, and we have meetings all the time, a couple of times a day, but we're not in the same room. Now, if you had said to me back a year ago that we would be managing a pandemic but not be together physically in one location, I would have said to you, you're crazy. That couldn't happen. But because of the use of technology now, that's what we actually ended up doing. That's going to continue. We're going to be working, a lot more of our population and workforce are going to be remote. We're going to be working remotely. With regard to delivery of care, we've been very used to traditionally where a patient comes in, sits in a doctor's office, waits a little bit of time down, sits with the doc, and then there is this physical personal interaction. So much of that is going to disappear over time because the doctor will examine you remotely, and you only need to come in to meet physically with the physician when it is appropriate. So I think it's going to change the delivery of care. It's going to change home care because you'll be able to remotely monitor people at home much more so than in the past. And there's many issues I could go into here, but the larger issue is one of culture. I remember before COVID, a lot of our physicians and others were saying, this technology, we can't actually deliver care using technology. Some people were converted, of course, but others were not. During COVID, those that were skeptical have now begun to use telemedicine in a major way, and I don't think we're ever going back. I think it opens up the possibilities of greater access, expanding, making it more convenient. So I think the delivery of care will change forever given the use of technology. And my guess is 2 or 3 years from now, we'll be using technology that today we can't even imagine what it looks like. But culturally, we've all readapted. I never thought I would be holding almost every meeting every day using Zoom. And quite frankly, I didn't know what Zoom was before COVID. I never thought I would be doing that. I will be doing that now ongoing. I do think we should get back in person again. And I think you're going to have a hybrid. A lot of meetings in person, a lot of meetings using technology. So you'll have that hybrid going forward. So I don't think we'll ever be going back to the way exactly we were pre-COVID.